community health worker is a frontline public health worker that is deeply rooted in the community and socially aware, culturally competent, and has the trust of the specific need of the community that they're working in.
Community health workers, often called CHWs, are trusted members of the community who play a crucial role in helping people live healthier, thriving lives. They assist with the management of chronic diseases like hypertension and diabetes. CHWs are uniquely positioned to support individuals by providing culturally sensitive education, connecting them to healthcare services, and offering ongoing support to help manage their conditions.
There's different aspects of the system where one county may not have ambulatory services and the other may not have an OBGYN. So we use community health workers and doulas to help identify those gaps and bridge gaps in access to healthcare.
They work closely with healthcare providers to ensure that patients receive comprehensive care that extends beyond clinic walls. CHWs educate people on how to monitor their blood sugar levels, understand their medications, and adopt healthier lifestyles. CHWs also help patients track their blood pressure regularly and identify triggers that may lead to spikes. They are that trusted resource to help you recognize when a high blood pressure reading might be an emergent situation.
What I feel is very important about community health workers and doulas is that we are part of the team. We are having more interactions with the clients. Sometimes we are well-versed in their medical history as well. And we are there to make the clients feel safe and secure.
One particular day, I wasn't really feeling too well. I thought it was just mostly because I wasn't getting enough rest.
So we were talking and she was kind of telling me some symptoms, and it sounded like something was off. And so you kind of have a checklist. So I wanted her to check her blood pressure.
I did take my blood pressure at that time and realized that my blood pressure was what was considered high. She let me know that, that was very serious and that I should make sure that I either go to the emergency room or get a second opinion about what my blood pressure was. So I decided to go ahead and go to the emergency room, and I was readmitted to the hospital as a result of that. And even through then, she kept in contact with me to make sure that I was okay and getting the treatment that I needed afterwards.
By integrating CHWs into systems of care, we create a more accessible, compassionate, and effective approach to managing chronic diseases while also empowering communities and improving health outcomes for everyone.
The spirit of community health work is making sure that communities feel comfortable and confident in advocating for themselves and living their healthiest lives.
We always have a second level of support. Having someone who has a greater knowledge of what you're going through, but also can serve as support and answer questions that you may not know you even had, is important.
Do you know your community health worker? To learn more, call 404-413-0198 or visit www.gachw.org. If you're currently doing community health work, you can help strengthen the infrastructure of the workforce by taking this brief 5-minute survey. Scan here to be counted.